Hello. A lot of time your doctor tells you that you need to have a scan, you need to have a scan early in pregnancy, again in 5th month, again in later. So how often do you need a scan? And some people worry whether this is going to affect my baby or not. So initially, the pregnancy is divided, as we know, into 3 phases. The first 3 months, then the second 3 to 4 months, and the last 4 months. So having a pregnancy in every trimester, as we call it, is important. The first scan is usually done around 8 weeks to make sure that you have a pregnancy, it is viable, which means that the fetal heart is there, cardiac activity is there, and it is not twins or something, or it is not outside the pregnancy. The second ultrasound we normally advise is around 3 to 4 months, that is between 12 to 13 weeks, for doing a scan called a combined first trimester screening, where we look at the baby on the whole, look at the baby's anatomy, and then also do some tests to check whether your baby fetus is at risk of having high risk or low risk of having any chromosomal or genetic problems. The third scan we usually advise sometimes is always rather is the anatomy scan, which is done around 21 to 22 weeks, again where we look at the baby from head to toe, looking at every organ to see whether it has formed and in proper structural part or not. And then we do another scan in the ultrasound scan in the 3rd trimester, which is around 32 to 34 weeks or even 36 weeks, to check if the baby's growth is proper or not, because sometimes it may not be completely reliable by looking at your tummy whether the baby is growing properly or not. So the minimum scans, ultrasound, basically ultrasound and scans, ultrasound scans are the same. So the minimum number of sonographies or ultrasound scans that you need in pregnancy are 3. One is the first trimester scan, second is the anatomy scan, and third is the growth scan, each in each trimester of pregnancy. But if your doctor feels that if you have other problems like blood pressure, diabetes, or if they feel that the baby is not growing properly, then you may need to have more scans which are perfectly safe for you and the baby, because the ultrasound does not have any radioactive rays that will affect you or the baby. So be safe, be prepared, and enjoy your pregnancy.